Recent flooding in northern Philippines has left more than 100 people dead and caused more than 100,000 people to be evacuated from their homes. We spoke with Dr. Marinus Gotink, health chief at UNICEF's office in the Philippines, about his recent visits to some of the areas hit by the flooding.
What one can see right now is major damage has happened along the waterways. That the people described it as a tsunami came. In about 1 hour or less, the water levels raised up to 4 to 5 meters above their normal levels, which means that houses built along the side of the river, the bridges, everything was completely destroyed, actually. And the water has retreated right now in many places, and it left an enormous amount of debris and mud. So there's a cleaning operation going on. There are many poor living alongside the river in shanty houses, little shacks, and they are trying to rebuild. They are trying to clean up with the very little things they have. And it's kind of heartbreaking once in a while to see how well they keep up their spirits. And these people have lost everything, so they need to have something to restart. That's what I saw.
How did this storm compare to other storms you've seen?
It is the severest rainfall in about 40 years in this area. And in those 40 years, the amount of population has enormously increased, and therefore also the vulnerabilities. And alongside the rivers, there are often informal little communities, and these communities have taken the biggest hit.
Can you describe to us what it looked like when you were there? What did you see?
Everything is covered in mud, but on top of that, everything is also covered in plastic, what is dumped in the river. The river is normally used as a garbage dump, and so all that garbage came down the river as well, and was dumped into the trees, on top of houses, in houses, and it stinks. And people are trying with their bare hands and with a little bucket to get the mud out of the place and dump it back into the river. And there's a huge need of safe water for drinking, but also for getting the premises more clean and doing the washing. Everybody is walking in clothes which are totally covered with mud.
What are your biggest concerns right now going forward?
The biggest concern is the lack of safe water. And the expectation is that maybe it will take another week before the normal system is providing that safe water. So from now until another week, there is a chance that all kinds of diseases may start to emerge. Therefore, we need the strengthening of the disease surveillance system locally, and we need to be prepared in terms of the health system.